Welcome to Motherhood Unstressed, a podcast for anyone who wants to let go of stress and anxiety and learn how to be more fully present in life. Each week, I'm speaking with experts in the fields of entrepreneurship, nutrition, mindset, sex, spirituality, and so much more. I'm your host, Liz Carlisle. I'm a writer, a speaker, and an entrepreneur. Through my own struggle to balance the demands of motherhood and life, I discovered that to truly be happy, we need to be present. Your journey to feeling less stressed and more blissfully present in your own life starts right now. Hey guys, thank you so much for tuning in. I am beyond excited to share this episode with Dr. Marissa Lawrence with you. I haven't been shy about sharing my own personal journey with breast implant illness and how I got my breast implants removed recently, and it's because I think it's important to share. I think it's important to share this kind of information with people who may not have even heard of BII or breast implant illness. And, they've been suffering for months, maybe years with autoimmune disease, and they have no clue why. So I'm just thrilled that I had my explant doctor on the show to talk about the data behind it, because you can hear a lot of stories and you don't really know what to believe, but she has been doing an actual study. She's the only doctor in America as of now doing a formal study on BII, which I think is incredible. And she went to Washington, D.C. to testify to the FDA at their recent hearing in March about what she has found. And so I think this episode is really going to be a great primer for you in understanding what exactly is BII and what you can test for with your primary care physicians to see what exactly is going on. And if you suspect that you have BII or someone that you know is suffering, then what are you going to do about it? And so she does just a great job in going over what it is, what you should test for, and then what the next steps are, and what really the data is showing so far, because it's just a huge undertaking, which I think you're going to understand by the end of this episode. So if you enjoyed this episode, please share it with a friend. Please leave a 5-star review, screenshot it. Let's get the word out about BII, what exactly is going on, so that we can help and heal absolutely the most amount of people. Thanks. This episode is brought to you by Motherhood Unstressed CBD. This is the supplement line that I created with the intention of helping you battle stress and anxiety in a natural way. Now, this isn't like you're taking some pharmaceutical. You're going to take these either through the tincture or the capsules, and you're going to feel a grounding out, a gentle calming down. And it's not stark. You're not going to feel drugged. But you are going to notice a difference. And if you don't notice anything, you could try to take a little bit more and see how you feel, because everyone is different and everyone metabolizes it differently. But this is really a great tool in your toolkit to help you be more you. That's the best way I can describe it. It's the best form of self-care that brings you back to who you really are and removes all of the exhausting energy that you would be spending on being anxious, being depressed, just generally not feeling like your best self. So this is my gift to you, and you can get yours in stores across the country or at my website at motherhoodunstressed.com. Well, hello, Dr. Lawrence. I'm so excited that you're here. I'm so excited to talk to you about this very important topic. Thank you so much for being on the show.
Thank you for inviting me. I'm glad to have this opportunity to speak to your listeners about a very important disease.
Absolutely. So I'm just going to jump right in with a question. How would you define breast implant illness?
Breast implant illness is very, very difficult to define. The problem is that the symptoms are nonspecific to one disease system. It is a disease that has effects on almost every organism, so it's kind of a nonspecific connective tissue symptomatology. And I don't even know if we can call it a disease yet, because we haven't defined exactly what's causing it, what its widespread effects are, and how to cure it. So I think we're still in a observation stage where we're collecting data. And I think the more data we collect, the more information we're getting. There are some patients who are very sick with positive laboratory results. The majority of patients don't have any abnormalities in their labs or diagnostic testing. And so it's very, very hard to put your finger on what is breast implant illness and what other diseases might be going on in patients, and what is caused by breast implants and what is not. So at this point, I think there are some very strong connections that we're looking at, but we really are still trying to figure this whole issue out. There are a couple of theories out there that are all very promising. One, of course, relates to a low-grade bacterial inflammation of the capsule. It's called a biofilm, and we're seeing that it may be implicated in the anaplastic large cell lymphomas that are being seen in a very small percentage of textured patients. 46% of my patients where I've tested the capsules will have positive bacterial cultures of the capsule.
Wow.
It's a small amount, and their skin flora, their skin organisms that normally are not harmful, but it just may be enough inside the body to trigger the immune system to, start a fight response. Another theory is a genetic predisposition to having something foreign in your body. I spoke with a woman who knows a lot about the MTHFR gene mutation, and she says that those patients can't tolerate anything foreign in their body. Mm-hmm. So it may just be almost an allergic reaction to whatever, to having a foreign body. Nothing specific in the implant or in the implant capsule, but just the fact that there's a foreign body in their body triggers their immune response. And then the third is metal toxicity. And we're going to look at that again, looking at urinary metal levels. But there is a brilliant toxicologist who actually testified at the FDA hearing, and he's been looking at that for 29 years. And he pretty much has discredited that theory. But I think it's still worth looking into one more time.
Absolutely. Well, that's amazing. And those are some things that I didn't even realize. And this is something that I've been studying. So tell us a little bit about your background and how it led you to even studying this issue. Because you're a plastic surgeon, you do surgeries all the time. So take us through that.
So I've been a board-certified plastic surgeon in Atlanta for 25 years. Mm-hmm. I have been using implants for my reconstructive and augmentation patients for 25 years. I've, watched the evolution of better implants, better shells, better fillers. I've seen so many happy patients with implants. And then about 2 years ago, I started to see a few patients who were not so happy, that were concerned their implants were making them sick. And we know that we had this issue in the 90s with silicone implants, but these women now had saline implants, which is supposedly safe. Mm-hmm. And I wasn't really sure what to make of them. I mean, I did review the literature with them, but I, agreed that if they wanted their implants out, I would be happy to take them out, and I could take it out with the whole capsule because I've been trained to do that and have been doing it for years. And I had my first patient who had a total body rash got better. Mm-hmm. I mean, it was, within 3 months, the rash had cleared up. Her brain fog was improved. She had more energy. And I was intrigued. So I started to, as I started to see more patients, because of course she spoke to friends and other patients, I developed a questionnaire, before and after questionnaire, just looking at everything. Then I was referred to the website, and I didn't even realize breastimplantillness.com that my name was listed, but it just was another source of referrals. Facebook was another source of referrals, although they threw me off that group because I was getting a lot of great information from patients on that, but I think they just didn't want a doctor, quote unquote, spying on them. Not that I was spying. I was actually just looking to see who got better, what symptoms got better. So anyway, I started collecting data. I had about 125 patients in the practice in October, and I was at a plastic surgery meeting, and they were filming us for the Plastic Surgery Channel, and they asked about breast implant illness, and I said, I don't know what's going on, but my patients are getting better. Mm. Then Mindy Hawes, who's out of Nashville, who's fabulous. She's a great leader. She said, let's get a task force together for the Aesthetic Society, and the task force was formed. So we had to first define what it is, and of course it was very difficult to figure it out. But we got breast implant illness frequently asked questions that we post on our websites, and then we did a questionnaire for all the plastic surgeons. Who's seeing it? What do you think's going on? Who's collecting data? Let's figure this out. And then that led to us all going to the FDA, where there was a lot of information shared but not a whole lot of answers. I think I was the only one who presented actual data on the patients with breast implant illness that I had collected. And as I said, I'm still very, very early in my studies. I'm still collecting data, and I have a pile on my desk I have to go through of post-op questionnaires and new patient questionnaires. But the things that stuck out the most to me are it's not one implant that's implicated. It's not one manufacturer. I see Mentor, Allergan, Saline, Silicone, Textured, and Smooth. Every implant has been implicated in breast implant illness. And then the other was that at 3 months post-op, because I've looked at the 100 patients at 3 months post-op, only a third of patients are reporting any relief of their symptoms, which means we have to follow our patients long-term just to see how much improvement they get. We're also looking at family history for autoimmune disease. I've started even looking at things like tattoos to see whether or not, because I'd like to do urine metal testing, but I think the tattoos are going to alter that. So I have to figure out how to distinguish what metal's coming from the breast implants and what metal's coming from the tattoos. So there's just a lot of different factors to take into account. We're doing, right now what I'm doing is I'm urging patients to get a genetic test through 23andMe to look for any abnormalities, and then we can see if, everybody in the group has a certain abnormality in one of their genes. Well, that would be a very important clue. And then I'm also sending the capsule for DNA sequencing so we can more accurately see whether there's yeast, fungus, and bacteria in the capsules. My Northside Hospital is picking up the bacteria, but I'm not picking up any yeast or fungus. So I'd really like to know specifically what are there more types of bacteria that we're not seeing. So that's important. And then, of course, the urinary heavy metal screening I think is important too. So those are where we're headed at this point.
Wow. I mean, it is a massive undertaking, but it needs to be done. Yeah, because it hasn't been done. This is all new territory. So talk to us a little bit about the hearing in DC. It was all over the news. And you stood up there and you gave testimony about, your study and what you've been seeing with your own patients. What were some key takeaways that you heard that day? I know you said there weren't a lot of answers, but what's something that our listeners need to know from that hearing?
Well, they looked at 7 factors. One was MRI screening of breast implants, and it was determined that most patients weren't getting MRI screening because it was too expensive. So they were looking at high-density ultrasound for ruptures of silicone implants to see whether or not that could replace MRIs, because that's something that could be done a lot less expensively and more efficiently in doctor's office. So they were going to look at the recommendations for monitoring. They were going to look at the informed consents very, very carefully. Patients were given a lot of information and papers to sign, and even the ASPS consents will talk about the risk of autoimmune disease, but patients didn't clearly understand what the risks were. So informed consent was very, very important. The other thing they talked about was the use of biologic mesh with implants in reconstruction, and that is a totally separate issue, but I think they're going to look for more stringent testing with the biologic mesh. I think that they were actually concerned about the quote-unquote mesh because of the vaginal sling mesh that was such a problem. Right. This is nothing like this. This is a soft tissue mesh that's used to actually hold the implant in place, but because it has not been FDA approved for this purpose, I think they're going to require more stringent monitoring of those. Then they talked about the use of real-world data in making decisions, and that comes into, looking at your breast implant illness patients and looking at all that data and trying to form opinions and make recommendations based on that data as opposed to just scientific data. And then there were 3 more. Oh, then it was the textured implants with ALCL, and I believe those are going to be restricted. I know they're restricted in Canada and France, and I'd be surprised if they're not going to be restricted here as well. And then the use of registries, breast implant registries. Again, we are required to use the registries, but non-compliance rates were very, very high, whether that was patients just didn't want to fill out the forms, or whether the doctors didn't solicit the forms from the patient is yet to be seen. But both the Aesthetic Society and the Plastic Surgery Society now have user-friendly registries where we can track our patients with implants and do follow-ups with them, so that my questionnaires would be great to put in those studies so that we see exactly what symptoms are developing when. And then breast implant illness, it was more, there are patients who are reporting it, we need further studies. And that's where I came in. I have a very early, very small study, but I'm the only one they've got right now.
Wow, that's amazing. In the entire country.
Yeah. Now, there've been studies in the Netherlands, there have been studies in Israel, but the controls were not what we had, it wasn't, there were flaws to all those studies. So we're looking at, I've got calls into a couple of other doctors who are tracking symptoms, and we're looking to see if we can get a large group study. It's interesting. It's already been accepted for publication, and I haven't written it yet. That's how anxious the plastic surgery community is for information about breast implant illness.
Well, and from, doctors such as yourself, I mean, where it can actually be looked at and trusted, that's what I keep coming back to, because anyone can tell, like, this happened to me, but no, you're looking at hundreds and hundreds of women and documenting their medical histories. I mean, this is groundbreaking. I'm so excited that this is going to be out into the world. So it's going to take a lot of work, a lot of effort, a lot of collaboration between patients and their doctors. I think that the unfortunate thing was 2 years ago when all this came out, there was not a collaboration between doctors and patients. And I think that there was some distrust on the part of our patients. But I think now that we're getting more real world data, I think that collaboration is very, very important. And I think it's very important for us to know what patients are experiencing. And I think, I know there's an ALCL Facebook group where doctors and patients are both on sharing information. I need to start one for breast implant illness too, just so patients can send me information that they've gotten, from their own experiences, even if they're not my patients, so that I can, at least get a feel for what's going on. Because as I said, if it wasn't for me on those websites, I wouldn't have gained most of the information that I have based on what patients are telling each other, because they weren't telling their doctors, or they were telling their doctors and their doctors weren't listening. Right, exactly. So if a woman is listening to this right now, she has implants, but maybe she lives in Kansas City, can she contact you and talk to you about?
Yeah, she can, but it's now becoming very, very widespread. Everybody knows about breast implant illness. I'm going to talk on a panel in May to all the plastic surgeons in New Orleans. Okay. It's all over the media. It's all over the news. And there are, doctors are more and more familiar with it. But they're welcome to, call me or email me. But, I'm in solo practice. And as I said, right. I saw 5 patients yesterday who all want to get on my schedule. So I am not going to be able to personally talk to every patient, but I am going to start a blog, and I am, and I can refer them to other doctors in their areas. Just hopefully I need to get this paper together so that we, there's more information for better care of the patients.
Absolutely. So for listeners who are, just hearing about BII, what's something that you want them to be aware of? What do you want to put into their field of awareness?
I want them to realize that the majority of patients with breast implants are fine. They don't have symptoms. But there is a small but growing percentage of women who are having nonspecific autoimmune connective tissue disorders that may be related to their breast implants, and they need to be evaluated. I think it's important to get medical evaluations from rheumatologists, primary care doctors, infectious disease doctors, in conjunction with being evaluated to see if your implants need to be removed. So I think if there is a concern, primary care doctors, we're trying to make them all aware of it, because we do need some lab work. We do need to see exactly we need to see what's triggering it. We need to see what the abnormality is. And as plastic surgeons, we don't have the knowledge that rheumatologists and infectious disease doctors have. So I think it's very important to work with different doctors and to see exactly what's causing it. The other thing is that let's say you do have an abnormal inflammatory marker preoperatively. Well, then we need to follow it postoperatively and see if it gets better. Right. So there's a lot of information to obtain, and we all need to put our heads together and figure out the best way to obtain it. So that's number one. Number two is I would counsel everybody to not get hung up on the en-bloc capsulectomy. That's ENBLOCK. I think it's important to get rid of all the capsule, but en-bloc is great if you can do it safely, but if you have implants that are below the muscle, the posterior capsule is on your rib cage and the anterior capsule is under your muscle. So if you aggressively go for the en-bloc capsulectomy and you're dissecting where you can't see, you can accidentally puncture a lung or you can damage the muscle that was on your chest wall that you really need. So I think that although en-bloc capsulectomy is nice if you can do it, I don't think doing a total capsulectomy is going to change your prognosis. As long as you get all the capsule out, you irrigate the pocket with a triple antibiotic solution, I think you're going to rid yourself of whatever is in that capsule. I also think that just because a surgeon does an en-bloc capsulectomy doesn't mean that they're not shedding capsule cells all over the implant pocket. So I think it's important to remove all the tissue and then irrigate it out very, very thoroughly with an antibiotic-containing solution. And I think that that's going to contribute to removing whatever is in that capsule that might be causing a problem.
Okay. And so when patients are going into their regular doctors to get lab tests, what exactly should they be testing for? What do they ask for?
I like to see, just routine blood work, electrolytes, but I'd also like to see inflammatory markers, C-reactive protein, SED rate, and anti-nuclear antibodies. These are all screening tests for inflammatory diseases. Okay. We want to screen for thyroid disease, adrenal disease, diabetes. We want to just see what other abnormalities they have so that we can rule that out. I mean, I don't think that breast implant illness causes diabetes. So if somebody has diabetes, we can say, well, that could be contributing to this. Now, I do have a lot of patients with Hashimoto's thyroiditis, and I'm just wondering if the implants aren't triggering that form of thyroid disease. I mean, a lot of people become hypothyroid as they age, but the Hashimoto's thyroiditis is coming up in a lot of my patients now, and that's an autoimmune disease.
Mm-hmm. Okay. Thank you. That's crucial. So I do always end with some rapid fire questions if you're ready.
Okay. Go ahead.
True health is?
True health is eating well, exercising well, feeling well, taking good care of yourself. I'm a big proponent of anti-inflammatory diets. I think that they will reduce inflammation in the body, even in patients even in patients without breast implants.
Okay. I believe in
listening to my patients. I believe in thinking about what their concerns are. I believe in doing no harm to my patients. And I believe in, just taking responsibility for procedures that I do. So, for example, I've been putting in implants for 25 years. I feel I have a responsibility to make sure that they're safe and to know who to put them in and who not to put them in.
That's so huge. And I do think, this study is just so symbolic of that feeling, that intention. I'm grateful for.
I'm grateful for my friends and family. I just lost my dad, and everybody has really, really come together for me. So, and it's interesting because he passed away 2 days before I went to the FDA, and I had been talking to him the Saturday night, and I was telling him all about my FDA presentation, and he was so excited for me. And I said, well, Dad, if you're not well, I'm not going to go. And he said, no, you need to go. And on Sunday, the Uber was right outside the hospital, ready to take me, and I went to kiss him goodbye, and I could tell he wasn't going to do well, and he passed that night. But I got on the plane the next day and went to the FDA because that's what he wanted me to do.
Wow, that's amazing. That's amazing. And lastly, what's something that you've learned in life that you or someone would have told you earlier on?
To have, I guess, well, I'm still not doing it, but to get a good balance in your life. You want to exercise, eat well, take good care of yourself, and then there's your emotional health too. Yoga, meditation. I do think there's a holistic approach to good health and wellness. So I do wish that I had focused more on a balanced life. Of course, now with all of the patients studies,
right.
I mean, I'm working 24/7, but it's my passion. It's my passion at this point, and I'm really hoping that we get an answer to this very, very soon.
Well, I'm confident with you working as hard as you are, and just with your experience, and that again, it goes back to that intention. I'm very confident that you will accomplish everything that you set out to do.
And just one thing I'd like to tell your listeners and patients: get your data in, get your data to your doctors, because it's very important that we see what's going on. I mean, it's a pain to fill out questionnaires. I've had patients email me back, I'm not filling out any more questionnaires. Like, please, just one more. Just one. Because I think it's so important that we're in an information gathering stage right now. And if our patients don't communicate with us, we're not going to get anywhere.
Right. We all have to work together on this. Absolutely.
Yes, we do. We absolutely. It's got to be a collaborative effort. You guys were, forceful enough with your Facebook groups to push this through. You made the doctors stop and realize that it was a real problem. Now you've got to move on from the initial rejection by some of the doctors and just help us get the answers and get the information.
Absolutely. Well, if our listeners want to get in touch with you, even though you are extremely busy, or just check out your practice if they're in Atlanta, how can they find you online? On
my website, drmarissalawrence.com. And I promise I am going to get a blog going on the breast implant illness. This way, people would be able to see exactly what the up-to-date research is going on. So instead of, blogs where I think we've figured out the symptoms, we've figured out the time frame. Oh, that was the other thing. The time frame is usually within 5 years of implant placement. But I think that now what I'd like to do is keep patients updated on the research data, what's going on, what studies there are, and what we're finding, because I think that's important.
Absolutely. 100%. And I think too, coming from a doctor's standpoint, not just a bunch of patients, like you said, saying this is happening, this is research, this is happening, this is minute to minute. We need this. So thank you.
We need to know. I think we know that there's an illness. We know that it may be related. We just have to figure out why.
Yeah, and have the data to back it up. Absolutely.
That's correct. Data is it's very important. Absolutely.
Oh, thank you so much, Dr. Lawrence, for being on the show. Thank you for doing my explant.
Fill out your paperwork. I know you have, so I'm really proud of you. I know you're proud of you. We'll need your 1 year paperwork back at some point. But hopefully you're feeling better, and hopefully we'll have most of our patients cured. Okay?
Absolutely. Thank you so much.
All right. Thanks for inviting me. Take care now. Bye-bye.
Hey guys, I hope you enjoyed this episode with Dr. Marissa Lawrence. Really, I hope that you learned a lot from it. And if someone in your life has been struggling with Hashimoto's or some kind of autoimmune disease and they have breast implants, please share this with them. We need to get the word out about this issue so that we can heal and help as many people as possible. Till next time, thanks guys.